My name is Rachel, and I'm the nursing supervisor for renal melanoma skin, GU, and thoracic head and neck oncology.
Hi, I'm Melody. I'm a nursing navigation supervisor. I support the sarcoma and breast team at South Lake Union, and I also support the community sites, so that's Peninsula, Overlake, and Northwest.
Hi, my name's Michelle, and I am a nursing supervisor for the nurse navigation team, and I support the hematology and the GI oncology teams.
So nurse navigation at South Lake Union campus focuses on access nurse navigation. Nurse navigators are the first point of contact from the time of referral until that first consult with a physician team. And then they transition over to the clinical nurse coordinators on the clinic side.
We also help really support the patients through one of the hardest times of their life. They just found out they had a cancer diagnosis, or they have something that they're undiagnosed and they're kind of scared of what it could be. So oftentimes we're the first people kind of talking through what it could mean, who they're going to see, and how we can best support them through this journey. So we kind of help support them as they enter their journey into the Fred Hutch system.
You know, a lot of what we do is we catch patients during a very vulnerable time in their lives. They're scared. There's this unknown of what do I even do from this point? And these nurses are there connecting and really supporting these patients and holding their hand and giving them guidance to help squelch that fear, really give them guidance and navigation to what's next, and helping stop that spinning that happens at first diagnosis. Really, we're really there to catch them when they feel like they're falling. So in general, what happens is we get a referral, whether it's a patient calling, looking for someone to support them, or referring providers, outside providers, sending patients to us for care. You know, what we're doing is nurses are connecting with the patient, confirming we understand the diagnosis, and doing a medical review from the start to make sure these patients are getting to the right place, and providing guidance to our scheduling and coordinating teams to get the patient to these right places, whether it's getting more diagnostics to getting a multidisciplinary team. It could be medical oncology, surgical oncology, radiation, and it may even be adding supportive care services. So we're really doing a thorough assessment of needs for this patient to make sure they're getting the right care, we're doing it efficiently, and we're really treating them as a whole.
So we have different models of navigation here at Fred Hutch. We do have some that are just access navigation. So that means we really just help make sure that we get them ready for their first consult so that they have the most productive visit with their provider, that they can walk away having some of their questions answered. And then we kind of hand off to the clinical care team afterwards to support them through their journey. But we also have navigators that follow them through survivorship. So we call them continuum of care navigators. And so they kind of help support them not just through the access part, but also through different teams. So whether it's from surgery and then to med-onc or radiation. So it kind of depends.
I came to nurse navigation because I was looking for a change from bedside nursing and looking to expand my skill set into different skills. And I found that the goal and idea of nurse navigation aligned with professional values of connecting with patients while also supporting staff to provide great access to care.
I have a background in infusion, and I feel like it was such a important moment for me to realize I love oncology. It let me connect with patients, but I also realized that it was a small part of oncology in their journey. And so with nurse navigation, I feel like you get to zoom out a little bit more and you get to see a little bit more about what their journeys would look like holistically and kind of help them navigate at the very early stages when they're most scared and vulnerable. And I felt like that's where I could make the most impact.
I came into nursing while working at Fred Hutch, supporting patient and family education and the resource center. And I learned real quickly that I had a passion for wanting to empower patients through educating them and helping them understand what was happening, and quickly went back and got my nursing degree. I've been with Fred Hutch the whole time, and in various roles, from BMT to transition planning. And I found navigation kind of by accident. A colleague of mine who I now work with happened to mention through social media, hey, come join me in navigation. And I poked her, I'm like, oh, that sounds great. What are you doing? And when I started to hear about the goals of navigation, of connecting with patients, of helping guide them to the right care teams, it really felt like it just checked a lot of boxes of trying to advocate, trying to educate, and give guidance and care. And that really just really sat with me and brought me to the navigation team.
I hope patients feel more empowered and that they have people in their corner to help walk with them through their diagnosis, because it can and is so scary and vulnerable up front. And so we can really align with folks and help connect them and stabilize some of that process for them.
So just bouncing off Rachel, I feel like healthcare and oncology in itself is also like feels like a different language. And I think for someone that's not in healthcare, or even if you are, oncology is so scary. This is different. And so I hope patients, when they call us, when they talk to a navigator, that they know that we are there for them, and that no question's too dumb, no thought is too silly to voice out. We're really here to support them how they want to be supported, and for them to feel open and feel like they can talk to us.
I really agree with a lot of what Rachel and Melody mentioned. Being the first person to connect with patients is so powerful. And I really hope patients can feel a lightening of the load they're carrying from diagnosis. I hope that patients can feel that they have direction, they have hope, that we're providing for them to really help them navigate a difficult system. It is really hard to navigate the unknown. So I really hope we give them some direction and hope.
I think we all go into nursing because we want to help people and really give back and do our part to like support our community. And I think for nurses that want to go into navigation, I hope that they remember that they're all doing wonderful things, that they're making an impact. And even if on days where it's really hard and it feels like we're not doing anything, it means a lot to the patient that you're talking to. So just always remember that.
It is hard. It's a different type of nursing than most of us have ever done before. It's not bedside, it's not micromanaging care, which needs to happen at different points in oncology care. But what we do is high level and a lot of coordinating between different departments and different people. So it's just, it's different.
You know, I would advise anyone thinking about going to navigation is to really prepare yourself by understanding how the clinic works, what the patient experience is. Because new patients coming in are really looking at you as an expert to fill them in on what is this journey going to be. You know, you are the first person starting that picture for them and really creating this new narrative they're going to live. And so having that experience and understanding of the actual clinical setting when they're there as a patient getting treatment is a really, really key tool when you're doing navigation.
I just want to say I really appreciate that Fred Hutch as an organization has put the time and resources to investing in the nurse navigation program. It's not something that every hospital offers. Like I just came from a hospital that doesn't have nurse navigation, and the difference that it makes in the coordination for not just the patients, but also just like the providers and like Fred Hutch employees, it makes a huge difference. So I do want to call out how special it is that we do have this program.
You know, I 100% agree with Melody that having a navigation program and having been at the Fred Hutch for a couple decades now, the feedback that we get from patients is just overwhelmingly rewarding to hear the feedback of, I just feel so much better just speaking to you. I feel like I'm in good hands. And to go into it with confidence with an organization and clinics that collaborate with us, you know, knowing that we can be that first representation of this amazing care you're going to get it's a great opportunity for nurses to help patients, but it's also just an amazing service for patients.
And I also really want to highlight, it's a service to the community, because navigation, we don't just talk to our patients. Oftentimes we're talking to people that are just scared and actually are never going to see us, but we're still offering that care and education that they might not get elsewhere. So I think it's a great service to our community and other people that we might not ever meet in person.